Hi, everyone. I am excited to have the opportunity to moderate this discussion and have such an incredible group here. I want to start by giving you each an opportunity to give a quick introduction of yourself and how your work relates to the issue of loneliness, but also how your background informs the perspective you take with this work. Um, let's start with Michelle and then go to Smiley and then Jean.
Thanks, Julianne, and thank you for having me at this Nextdoor Leadership Summit. So my name is Dr. Michelle Lim. I am actually based over in Melbourne, Australia, and I'm a clinical psychologist by training, but also a loneliness researcher at the Swinburne University of Technology over here. I'm also the scientific chair and chairperson of Ending Loneliness Together, which is a national organization in Australia that filters around 50 different organizations across all states and territories who really focus on combating chronic loneliness in Australia. And I'm also the co-director of the Global Initiative on Loneliness and Connection, in which Julianne is also part of. And we have about 12 member countries now as well focused on both addressing loneliness, but also promoting social connection.
Thanks. Let's go to Smiley.
Thank you, Julianne, and thank you all for being here today. I'm a huge fan of Nextdoor, and it's great to join all of you, and thank you for your leadership in your communities. My name is Adam Smiley Poswolsky. I am an author, a speaker, and a workplace belonging expert. My most recent book is titled Friendship in the Age of Loneliness, and I really believe that if loneliness is the problem, which it is, it's an epidemic, friendship is the antidote, or at least it's one of the antidotes. We're currently facing the lowest levels of friendship in the United States. And I believe that creating kind of tangible, practical things that people can do to spend more time with people in their communities, their friends, and making new friends and deepening relationships in the workplace where we spend a lot of our time, whether in person, virtually, or hybrid, is one of the most positive things we can do to build better relationships with each other and support each other, especially in the wake of the pandemic. So I'm very excited to talk to you today about this really important issue.
Thanks, Smiley. Let's hear from Jean next.
Well, thank you so much, Julianne. I'm excited to be part of today's conversation and also to be here with Smiley and also with Michelle. Jean Accius, I'm the Senior Vice President of Global Thought Leadership at AARP. I have the tremendous opportunity to work with colleagues across the country, as well as within states and communities, to really help us reimagine how we make our communities more livable. And particularly in the context of loneliness, we know that 1 in 3 adults over the age of 45 in the U.S. are lonely, and those numbers are only increasing as a result of the pandemic. And that has huge health implications, but also huge financial implications. So we've been on this journey, particularly as an organization, to think about ways in which we can create solutions and programs to close those gaps and ensure that each person, regardless of where they live, have an opportunity to live a longer, healthier, more productive life and a more connected life. So I'm really excited about today's conversation.
So let's kick this conversation off. I'm so excited, and in fact, Jean, part of your introduction really laid some of the groundwork for my next question, and that is, you talked about some of the mental and physical health consequences around isolation and loneliness. And given this research and the concerning prevalence rates, this has led some to refer to this as a public health crisis. So this next question, I guess, is really open to any one of you, but why do you think it's so important to talk with others about loneliness, whether it's your friends, neighbors, family members, or other people in our community?
Well, Julianne, I'll kind of kick us off. I think it's important for many of the points that you just raised, that the number of people who are lonely has only exacerbated as a result of this pandemic. And it has huge implications in terms of mental health. It has huge implications in terms of total well-being. It has huge implications in terms of quality of life. And I think that there are opportunities for us to think about ways in which we can get reconnected. I think some of this particularly might be language. When we first started to experience this great experimentation called this pandemic that no one really signed up for, we were told that we should socially distance. And just that term itself was problematic. We should physically distance, but stay socially connected. And I think language matters significantly. And I think one of my aha moments, particularly over the last 2 years of being quarantined at home during this great experimentation, was how much we took for granted those connections, whether it's in the workplace or within the community. So as things are now starting to reopen, I know that for me and for many of my colleagues at AARP, we have created a range of different platforms to ensure that people stay connected. One of the things at AARP we've created is something called the Friendly Voices program. And these are volunteers calling older adults who have identified themselves as being lonely and just wanting to connect by phone. We know that connection helps both in terms of health as well as longevity. And then the other thing I would just quickly say, because we're approaching a range of different events, take the time to get to know your neighbor if you haven't gotten a chance to know your neighbor, given the platform that we're in today. Research shows that just having those conversations helps to create that network of connectivity that can ensure that people are less lonely and help with some of the mental health issues that we're seeing.
You know, you bring up such important points of how this really became such a critical issue during the pandemic, and I'm curious. I want to hear from Michelle, given you're located in Australia, and some of the really strict kinds of restrictions seen in Australia. And so what are some of the unique ways that you saw loneliness increase during the pandemic? And what ways did you see communities and individuals step in to offer support during this unprecedented time?
Very good question. And in many ways, I'm in a kind of a very unique city. Melbourne was in I guess, quite strict lockdown for most of during the pandemic, and in fact, 263 days, which is quite a lot. And most of it is spread over 6 lockdowns, and we were not, for most of that time, we were not allowed to really walk outside or travel outside 3 miles of where we live. So I felt personally it was a Groundhog Day situation for me. Things became very monotonous and our social interactions are very restricted. That said, many of us, I think, found ways of trying to connect digitally or via phone. But in a very prolonged duration, even as a psychologist, I could feel myself kind of feeling malaise because there's only so much phone and digital connection that I could have personally. Perhaps I'm maybe too old for the younger generations that kind of reaching out digitally is quite a norm for them. But I really miss that kind of one-on-one interaction or kind of the loose social, the connection, the social interactions that we might have. That's kind of with acquaintances or strangers. And I underestimated how important that kind of interaction was to me while I was connected to family and friends. That kind of interaction where you have that organic interaction where you might see someone at work and, the water cooler chat or, bump into someone in the coffee shop and have a chat. Those sorts of things matter a lot more. And I hope that the lessons learned from this pandemic means that people realize how important our community is, because, as I said, many of us couldn't leave more than 3 miles of radius of where we live. Our neighbors became another source of very important connection, which we had to capitalize on. So if you didn't know your neighbor before, you had to know your neighbor, during the pandemic.
That's so interesting how it's so true, how those just small interactions are so important. As you talked about that, even just like the water cooler effect, it reminds me of how you wrote a book recently on friendship in the age of loneliness. And I'm curious, how the pandemic affected the content of this book, but also, in essence, how you can translate workplace belonging into neighborhood belonging to ensure that communities thrive through human connection.
Yeah, I think it's what it makes me remember is going back all the way to early 2020. I had pitched this idea for a book about friendship in the age of loneliness before the pandemic. I said, hey, look, I'm this guy, Smiley. I'm a pretty extroverted guy. If you can probably tell, my nickname is Smiley. I've had that nickname since high school. And I literally go around and meet people for a living. That's my job. I go to events and conferences. And I said, look, I'm struggling with loneliness as this extroverted, outgoing person. Something's up here. And you do the research, and most of it and many of it is influenced by you, Julianne, and much of it is your amazing research. 2/3 of Americans are lonely, loneliness spiking all around the United States and the world. And you realize you're not alone. And so the publisher said, okay, this is a great idea for a book, but if you're really targeting Gen Zers and millennials, you can't put loneliness in the title. No one wants to admit they're lonely. And I said, well, I am lonely, and this is a huge problem. A lot of other people are. They said, okay, we'll do the book, but you have to change the title. And I said, okay, well, I want to do the book. And then 3-4 weeks later, it's quarantine. And the publisher reaches back out and is like, you know what? Maybe you can include loneliness in the title. We're all struggling with it. So it took a pandemic. And I'll say this bluntly, it took a damn pandemic for us to be able to talk about this openly and to put it out in the open. And so if there's a silver lining from this experience, which has been really horrible in so many ways for people all over the world, I think that we're talking about things like loneliness, like social connection, like mental health, right? Like inequities in the workplace that frankly were very much existing long before COVID-19. But now there's an acceptance and an understanding that we can talk about this. We all had that shared experience, right? And a shared experience gives you a place to start. And hey, I'm feeling this too. You're feeling this. Oh, our whole neighborhood's feeling this. Our whole workplace is feeling this. We can talk about it. So I think for me, that's what I'll look back at this time is this was a silver lining of being able to put this out in the open. And at least and try to address it in a more serious way, a more collective way.
So, you bring up such an interesting point about how loneliness has been such a taboo topic, right? And there's been so much stigma around it. And this idea that perhaps one of the silver linings around the pandemic is that it's been this collective experience that because isolation was so widespread, that perhaps there's greater openness to discussing loneliness. And so I'm curious, do you think that there's still some level of maybe hesitation around talking about this, or do you think that's gone away? And if it did help, can it be sustained? I'm curious because I know there's a lot of concerns about how open people are to talk about this. And I'm opening this up to anyone who wants to jump in and just share your thoughts on that.
Julianne, I think I might take a stab here, but we have a panel of lived experience people who've had either kind of more persistent loneliness that we engage with in our work. And, the most interesting things I've heard from that is that when someone says they're lonely, the response from the other person is usually quite negative because it's almost like a reflection on the other person, that perhaps, they're not catering to your social needs. And also people don't know what to do. So it kind of puts people in a pause. So what can I do to help? And they don't actually know how to have that conversation. So there's almost this inability to respond. And also, as we know, it's an issue that's rife with misconceptions that if you're lonely, then there's something wrong with you. when in fact, actually, we know now that loneliness is an innate signal for us to seek other people out so we can thrive and flourish. And this stigma stops people from getting the help they need at the right time, at the right place. And then people then lapse into persistent loneliness, which we know from research. Persistent loneliness exacerbates mortality and morbidity of disorders. So we need to kind of address the stigma and the way we talk about loneliness in our community for people to feel empowered to seek the help they need as opposed to withdraw.
And
go ahead, Gene.
If I could add to that, I think that this is an opportunity across sectors to really think about the solutions in order to address this. And what I mean by this, particularly in the United States, we've done some work with Stanford that found that, particularly with loneliness, that there's a huge cost to the Medicare program, which is a major health program, particularly for those over the age of 65, at the point of about $6.7 billion a year because of the health-related implications of loneliness. And when we did the research, what we found was the fact that there were certain subpopulations that were disproportionately impacted. For example, individuals who are in a caregiving situation. So if you're caring for a family member or a loved one, or someone that has limited resources, those individuals were, in some cases, disproportionately impacted. And we even saw some of this, particularly during the pandemic. A family caregiver concerned about leaving their home out of fear that if they come back, they will bring an infection back that might impact and affect the person they're caring for. So I think we have an opportunity here to think about what are some of the levers, both in terms of public policy area, but also in terms of private industry, to solve for this. Employers have a major role to play because of some of these health implications. So how can we create a culture of connectivity to ensure that people are more connected? And I think that's one of the key elements to your point, Smiley, that you mentioned, that, this pandemic has created a pathway for us to not just have these conversations, but equally important to figure out exactly how do we start to create that culture of connectivity in a way that is sustainable over the long term.
So, Gene, you bring an incredible perspective, and I want to ask some follow-up questions because you come from the perspective of the aging population, and of course, all of us have someone in our lives, perhaps even ourselves, who may be aging and may need special kinds of attention. And so, from your work, I'm curious if you have some advice or recommendations on how maybe loneliness affects this particular group, or unique ways to help remove barriers among this group.
Absolutely. And thank you for that. I'm a big fan of your work and that of Michelle and Smiley. So I'm really excited about this conversation. And frankly, I am very humbled by this discussion. I will say that a couple of things. One is the fact that we are seeing a population that's not just aging, but living longer in many cases. And we know that part of the issue with loneliness is that particularly as one ages, your social network starts to decline. So I do think and there's huge implications across gender and also in terms of race and ethnicity. So we do see, as part of the research, but also as part of the opportunities, how can we start to address some of the loneliness that we see across the life stage? In part, as I mentioned with caregiving, for example, there's over 48 million people in the United States who are caregivers, and they find themselves on this journey. But of those 48 million caregivers, about 15 million or so are millennials. And we've done some research that have actually demonstrated that those millennials are in many cases lonelier than older generations, in part because of the work and the care that they're providing. And if you think about it, in many cases, their life has become interrupted by the care that they're providing. because of that life stage. So really opening up this broader conversation around not just what are the solutions, but what are the opportunities for us to really think about ways where we can create better systems. And one of the ways we can actually do that is think about how is our built environment, where you live, where you eat, where you play, where you work, is conducive to creating opportunities to facilitate connectivity across ages and within your neighborhood. We created something called the livability index. And I would highly encourage those who are watching us today to take a look at it. And you can actually go on AARP.org and put in the livability index, put in your zip code, and it'll give you a score in terms of how livable is your community. And it takes into account parks. Do you have walkable streets? Do you have access to a range of options for civic engagement? All of those matter, particularly as you age. And I think that's a critical important, and there's some solutions. So there are things that we can actually do to ensure that where we live is fostering an environment and a culture for connectivity.
So I think we're all going to jump on there and look at how livable our community is and our neighborhood. And, I think that segues so perfectly into, what I wanted to ask all of you, and what I think so many of these neighborhood leads are wondering is, do you have some practical tips to offer our neighborhood leads who want to help out a neighbor to build more socially connected communities?
I think the biggest feedback that we get over here in speaking to our community is that people who feel lonely already feel terrible about themselves. And even though they are motivated to connect and they want help, sometimes it's incredibly hard for them to seek the help they need. And the response that you give to the person who's seeking the help is really incredibly important. And people who are lonely don't want pity, or, they don't want to feel small and belittled. So it's about how we can empathize in a way that we can empower and give them feasible things and steps that they can do. So I think it's really important about your response when someone says they're lonely. And I'll leave it to other distinguished guests here to talk about, how someone can seek help. Yeah.
Smiley, do you I just in the fact that your name Smiley, I think that's probably one practical tip, right? A smile can go a long way.
It is actually biologically proven to make people feel better to smile more.
But I'll invite you to go beyond that.
I think, so a section in my book is called Be a Minister for Loneliness in Your Community. And, I really believe that every nation needs a minister for loneliness. We have, I believe, some in the UK and Japan. Hopefully, Dr. Vivek Murthy is working on that in the United States. I'm sure he is all about it because his book Together, which is about this topic, is fantastic. But so we need the top-down structural stuff, but I also believe that we need to kind of step up and do these individual small things in our community. And what does it look like to be a minister for loneliness in your community? It probably means very different things to different people because we're all unique and different. And I think it's those kind of small actions, whether it's posting up outside the local cafe and just saying hi to people in the morning, or offering to buy the person behind you a cup of coffee, or hosting a potluck, or if someone's new to your neighborhood or new to kind of the school or daycare that your family's a part of, just welcoming them and say, hey, you belong here. If you need anything, please feel free to give me a call, or here's my card. I, have a friend named Sahar. He has a business card, and on the business card, it says, let's be friends. It has his name and his cell phone number. Anytime he meets somebody interesting, he gives them the card. It's a very lo-fi way. And then he invites anyone that he's met in the past month to a potluck at his house. And they were doing this obviously during the pandemic over Zoom, and now it's in person. Very simple, but very effective. I think oftentimes those little acts, there's been a lot of research showing how effective and important it is. We often underestimate sending someone a text message. We think, we're just sending them a text. it actually really is really helpful to make them feel more connected. Or a tiny act of kindness, buying them a donut or giving them, just a word of affirmation is really important. And then also to piggyback on what John was saying, I do really believe that intergenerational friendship is critical especially with the rising aging population. It's beneficial for young people. It's beneficial to people that are older. So anything you can do to hang out and spend more time with people that are older than you and people that are younger than you as a positive, whether that's volunteering, whether that's mentoring, whether that's simply getting to know people in your neighborhood, it's really, really critical.
So thank you, because I'm just going to add, when you mentioned small acts of kindness, Michelle and I actually, in partnership with Nextdoor, actually tested this. And what we found was that some of these small acts of kindness, very simple things, like you mentioned, resulted in significant changes in loneliness. So they can have powerful effects. I want to give Jean an opportunity to jump in too. Let's hear from you. What are some of your practical tips?
Well, I really love the small acts of kindness because I think it's just mutually beneficial. And to the point that was made, I do think that there are some things that we can do as individuals and that there are things that we can do as a collective community. On the individual front, one of the things I would just add is just the opportunity to just journal your thoughts. The connection between journaling and meditation is helpful from a total well-being perspective. I think given the fact that we are with leaders as part of the Nextdoor Leadership Summit, that there's an opportunity for us to think about what are the resources that are available within your community to address the issues of loneliness. And can we pull all those resources together into a central hub? That way, that could be a place for people to go to figure out what resources are available for them in their community. So how do we start to create some of those type of resources? The other thing I would say is the fact that look for opportunities for connection, whether it's a book club in your neighborhood or a walking club, a running club, a bicycle club. Just find different ways to connect. And that also helps with your health. So I do think that there are some things that we can do as individuals, but there are also some opportunities for us to think about what Michelle indicated earlier, that oftentimes, people don't want to be pitied. And in many cases, they're trying to figure this out, but might be overwhelmed. So let's create some systems that are very person and family centered and resources that can really be helpful. So when you are on this journey, that you can know exactly where to turn and to see what's available for you.
Well, and Jean, I just want to thank AARP for showing such leadership in this area also, because, some of the resources that you were talking about, the Commit to Connect.
Yes.
And so that's one potential resource
Absolutely.
that people can certainly draw on. Well, I know we could talk about this for a really long time, but I do want to ask one last closing question. I want to give each of you an opportunity to tell us what community means to you and what role it has played in your life. And maybe we can go in maybe Smiley and then Jean and then Michelle.
I love this question. Also, I loved everything that Michelle was saying and Jean was saying, especially about the resources and the hubs. And I know a lot of work, again, maybe a silver lining of the last 2 years is that it feels like, I don't know to you all, feels like there's more hubs and places to go for this stuff, which is great. More centralized locations where we can find more resources to get involved in our neighborhood, to combat isolation, to support people with mental health. So that I'm very hopeful about that, and I'm excited about that. What community means to me is having believers. It's having people that believe in the beauty of your dreams. It's having people that are going to go to bat for you. Having people in your corner. in your work, in your life. That can be, in so many ways, can be from a neighborhood group, can be a religious institution, can be an organization like AARP, can be friends. It's having people in your corner. And I think the sad truth, as we know from the numbers, is that just a lot of people don't have people in their corner right now, or don't think that they do. They actually might, but they haven't been told that or reminded that, or estranged from family, or estranged from community, or estranged from the institutions that I think used to provide that, right? So reminding people that they have someone in their corner.
And I would build on that. I think it's fair to say that because of the shared experience over the last 2.5 years, that we are going through a transformative period, both as communities and neighbors, but also as individuals. And I think that part of that transformative period is the fact that we're having to get reacclimated or reacquainted with individuals, whether it's ourselves, our family members, or even our neighbors, because in many ways we've changed. And one should not assume that the same person you knew pre-pandemic is the same person that is in front of you now. That person may look the same, but there's a significant likelihood that person is somewhat different. So community, to me, is really, to the point that Smiley made, trying to find a shared sense of understanding and a shared sense of vulnerability to know that we're all evolving, that we haven't figured this out yet. And it's okay to say we haven't figured out yet, because we're trying to, frankly, get the foundation right so we can figure out exactly how to move forward. And that shared sense of understanding and that shared sense of vulnerability is what I consider to be community, in part because of the fact that we're all trying to figure out what's next.
So I think Smiley and Jean has put it so perfectly. And I think for me, community was very much that shared experience. And it's become actually much more flexible in the way I think about what the defined community is pre-pandemic and post-pandemic. And community is also something that is what you make of and the effort that we put into and what we get back. And many of us, if you feel you don't have a community, it's possible to make one. And even if it's starting just with one person, and to build that community out. And for me, I think that I've built communities and moved countries many times. And it's always been a slow process, sometimes actually growing the community. And I think it's important, though, to be really patient and to kind of put in the effort. And those things do pay off, because before you know it, being surrounded by people who care about you, who understand you, that you can turn to and talk to, really pays off in huge dividends.
Beautiful. I want to thank you each so much for your incredible perspectives on how important community is, the toll that loneliness and isolation can take, the unique challenges that individuals face every day, and why, of course, neighbors have an opportunity to support each other, particularly during challenging times. Each of you have certainly broadened our perspective on these issues. And I'm sure that I and everyone else listening appreciates the work that you're doing. So thank you.
Thank you.
Thank you.
Thank you.